Palliative care. So, palliative care, in this contents, we are going to speak about introduction, history, definition, principles, quality of life, palliative care team, ethics, rehabilitation, management of pain, oral care, nutrition, wound care, bereavement and grief, measurements to strength, palliative care, and conclusion. So, we are going to deal in this all subject. So, introduction. We all are born to die, but must people die in misery? Is a question mark. Means like people should die very peacefully, is the quest. Palliative care refers to enhancing the physical, psychological, emotional, and social, spiritual, and existential well being of patients and their families. So, it will enhance all those psychological component. Kidney failure, chronic liver disease, multiple sclerosis, Parkinson's, dementia, cognitive anomalies, drug resistant tuberculosis, and in certain chronic diseases such as cardiovascular diseases, AIDS, diabetes, and in cancer, this pain and difficulty in breathing. This all should be solved in a very peaceful way. So, coming to the history, the first hospital of palliative care team was established in Royal Victoria Hospital, Montreal, by Balfour Mount in 1976. This was the starting point of palliative. So, next, St. Thomas Hospital, London team, established in 1977. So, coming to 2003, Pallium India, a national registered charitable trust was formed, first registrable trust. Second, in Kerala state government implemented the palliative care policy. In 2008, they were so advanced. 2010, the Medical Council of India recognized palliative medicine as a specialty. 2012, Maharashtra state government implemented the palliative care policy. National program for palliative care was launched by Government of India. And 2016, Kerala University of Health Sciences included palliative care into the BDS curriculum under the subject of public health dentistry. This is a big landmark which whole country should follow. Space care. Receive end-of-life care at home or in a specialized care. Survival is typically less than 6 months. To minimize pain and discomfort is hospice care. So, health-related quality of life is a big questionnaire through which disease-specific, domain-specific, and generic can be estimated. And the same thing with McGill, end of life, and quality of death and dying. These all are the questionnaires which can measure the quality of life and the suffering of a person. The palliative care team, who are they? A small number of people with complementary skills who are committed to a common purpose, performance goals, and approach for which they hold themselves mutually accountable are called as a palliative team. And delivering bad news. Spike's protocol for delivering bad news. Nurse model is used for demonstrating empathy. So, Spikes is nothing but a protocol for delivering bad news, and nurse is used for demonstrating empathy. Definition of ethics. Ethics is defined as a science of ideal human character and behavior in situations where distinctions must be made between right and wrong, duty must be followed, and good interpersonal relations maintained. In principles of ethics, this comes in the regular ethics chapter only. To do no harm, to do good, respect for persons, justice, veracity or truthfulness, and confidence. So, coming to the rehabilitation part, a process enabling people with disabilities to reach and maintain their optimal physical, sensory, intellectual, psychological, and social functional levels. This is given by WHO 2017. Next is bereavement. Bereavement is a period of mourning or state of intense grief, especially following death of a loved one. Grief. Grief has been described in terms of stages of or tasks, but it has to be emphasized that it is not a neat and ordered process, but rather overlapping phases of a mixture of emotions and responses. Stages of grief. Initial shock, pangs of grief, despair, adjustment. Conclusion. The World Health Organization has identified palliative care as one of the 6 major components of chronic disease model of care. End-of-life care is considered as a public health issue for a number of reasons. First, a large number of people are affected. Second, end-of-life is associated with the suffering for both patient and family. And finally, on a society level, there are huge financial implications of chronic disease that have an impact on families and communities. To come practically to say about this palliative care, in simple terms, we can take a cancer patient. In a cancer patient, first and foremost thing will be to deal with his depression, to be with him emotionally strong, give him emotional support. That moreover, for pain management, they used to they, in previous days before 2010 they doesn't use care much. They used to give the basic painkillers, but right now in palliative care has so much advanced, so that you get patches, nicotine, see, like similar like nicotine patches, you get morphine patches, and you have morphine tablets, which totally makes their life peaceful. And in certain Ayurvedic medicines like Himalaya Drug Company brings out with marijuana based tablets that really helps them to completely overcome the pain, which never used to be the same when we use only English medicine tramadol. So such kind of what you call painkillers in a very different variety of places, how you apply lives palliative care. When pain is not there, the person's emotional quotient will improve, and first and foremost thing is to relieve pain. So this palliative care is more important than rehabilitative or treatment aspect in my sense. Why? The reason is you are relieving his pain. This is a godly work. So palliative care should attain its proper value, and it should be opened in each and every center of districts in India, district hospitals in India. That is our wish. And moreover, general public should have more aware that such a care is available after the final treatment, end of life, when the hope is being left out, this care starts. Thank you.